the people that have always tried to publish something, but because they are going against the narrative, they cannot get published. Now they have an avenue where they can publish. If their data is good, I don't care if they tell me that they're using a magic mushroom to, cure something. If the data is there and I can prove that that's there, we're going to publish it. We're going to publish it. We are an avenue for people to get their true research well done, in the most or strictest mode of scientific conduct, ethically sound, to be able to publish. That's what makes us different than the rest of the world.
It has become increasingly clear that medicine and health have been heavily politicized over the last few years in light of the government's COVID-19 response. This made following the actual evidence-based science nearly impossible, especially when coupled with mass censorship and a captured mainstream media. Those questioning the status quo or the prevailing narratives were left largely in the dark. And medical professionals, doctors, researchers, and scientists were prevented from conducting ethical research or publicizing said research because of the inherent bias of pharmaceutical-funded peer-reviewed journals. That's why in today's interview and report, I'm featuring a group of ethical and objective medical professionals who have begun a new path and are founding a new, truly independent medical journal. Dr. Joseph Varon is a founding member of the FLCCCA, which stands for the Frontline COVID-19 Critical Care Alliance, and he is now going to serve as the president of this new, independent, unbiased, and innovative medical journal called the Journal of the FLCCC Alliance. As maligned virologist, epidemiologist, and vaccinologist Dr. Byron Bridle, who is associated with this group, put it in his Substack recently, I can verify the need for new journals with ethical standards. I have directly experienced the coercion of the peer review process, including from a journal editor to modify wording to dampen the impact of concerns on the global narrative that was pushed about COVID-19. Failure to comply would mean rejection and therefore an inability to get important raw data into the public forum. Joining me to discuss this initiative is Professor of Medicine at the University of Houston and a frontline physician treating patients throughout the COVID hysteria, Dr. Joseph Varon.
Well, I was working nonstop. I worked for 715 continuous days during COVID. I had the opportunity to see firsthand what was going on with patients, and I realized that this illness has been politicized. It was an illness that you have people thinking vaccines, other people were thinking ivermectin, other people were thinking remdesivir, and things got really, really bad to the point that I was having difficulty practicing real medicine because of so much pressure. That's what really woke me up and said, hey, there is a problem. And even though I knew that, the healthcare system was not perfect, when this happened, I realized that the healthcare system was completely destroyed.
Now, faced with this pressure and a desire to save patient lives, Dr. Varon banded together with other physicians who were seeing that the prevailing treatment and narrative was doing more harm than good. That's when he founded the FLCCCA, which was instrumental in pushing back against the politicization of medicine.
Well, the one thing that we did was to follow the science. We follow the science. The five of us who started the FLCCC were people that really were scientists, yet clinicians that were seeing patients. And we looked at what was working. Many of us were trying things that actually were making a difference. For example, my mortality rate in my hospital was the lowest in the country. And you said, well, we're using a combination of cortisone, we're using vitamin C, vitamin D, we started to use ivermectin, and our patients were doing well. So that's what really woke us up and said, hey, the other people out there are using things that are probably not working. And in all fairness, we tried some of the other things. We tried the remdesivirs of the world at some point in time, but we saw that they were not working. So we became very cohesive. That brought with us a lot of people that started to follow us because they said, hey, what these guys are doing makes sense. And it was making a difference. We saved a lot of lives.
In order to continue making a difference, Dr. Varon explains how the launching of this new independent medical journal will fill a much-needed void in science, research, and medicine.
First of all, we are self-funded. That means we are getting funding through donations and, people wanting to help. We do not rely on Big Pharma or anybody else, which is a great advantage because sometimes I'm sure you have seen, there was a vaccine paper that was published in New England Journal of Medicine in which 20 out of 26 of the authors worked for the pharmaceutical company that was pushing a specific vaccine. Those are things that we cannot allow. Our journal has a very strict peer review. So, for example, when I get a paper, I send it to one of the reviewers, but I delete the names of the authors. I delete everything. So they don't know who the authors is. So if you had a friend that wrote a paper and just because you know his name, you say, oh, let's go ahead and accept the paper. No, this is a very strictly peer-reviewed journal, which hopefully is gonna make a difference. The other thing that is interesting about the journal is that the journal is going to have a small section for lay people to also write their, papers. So it's medical. I'm going to say like 95%, but then it has an area where actually normal people can go ahead and write, especially nowadays that people are following the science. We see it in our own followers at the FLCCC. Some of them know a lot of medicine. People that have never been involved in medicine, after 4 years of studying what works, what doesn't work, what's going on, we're getting a lot of people that are really getting involved into this. So I thought that was a very good idea. I want to make sure that our journal has high quality papers, but not just on COVID. It's going to have on everything. We're going to have on the use of repurposed drugs. We're going to have reviews. We're going to have analysis of other papers at some point in time. We're going to have case reports. It's going to be a really good journal. I expect our first issue to come out sometime in late October or so. And initially it's going to be electronic publication. And then as funding comes in, we may decide to have a paper copy. I think that there is a lot of interest on that. And you look at the comments that people put on, on Facebook or Twitter or stuff like that. The most common one that I see is it's about time. It's about time that this is a refreshing idea. Somebody coming in without any bias. Conflict of interest will be non-existent. I'm going to have even an ethics review team that is going to make absolutely sure that we have no conflicts whatsoever. If there is a conflict, I'm not taking the paper.
But the peer review process itself has been scrutinized lately as not being nearly as effective at proving sound science as replication is. Here's what Dr. Varon had to say about that.
Well, the fact is that there are a lot of people that are replicating data. There are a lot of people that are not even understanding the data, and they analyze it in different ways. So one of the things by which we are doing this, if I see that there is a complex study that requires strict statistical analysis, I'm going to have a statistician review that paper just to make sure that there is no bias. As you know, there have been a series of papers that have been tremendously biased. And then once you re-review the paper, you come up with a completely different analysis. Just last week we had that with Professor Donzelli from Italy in our webinar at the FLCCC. He educated us that sometimes just analyzing the data in a different way gives you completely different analysis. And that's extremely important when you are providing data out there for people to read, especially for people that are not too aware of statistics. You need to be very clean on that. Because I usually tell people, a statistician can make something statistically significant no matter what.
So who's the team behind this medical journal? Dr. Varon explains that he is building this team and he continues to recruit for this journal.
So as far as expertise, we have half a dozen of biostatisticians, and that's the only thing they do. We have about 50 peer reviewers, and I'm, still recruiting. I'm recruiting peer reviewers from all over the world. And these are people that have written extensively. I'm not just getting anybody that's junior to start reviewing. I'm talking about seasoned scientists that have read that. I have very good people that have been very involved in their areas of expertise. So, like, I have somebody that is a very good cardiologist. I have a fantastic obstetrician. I have a great pediatrician. I have people that are well known, that have written books, that are known to be the key opinion leaders, that have completely told us we'll be happy to participate. We know that you guys are still not indexed because it's going to take some time to get us indexed into the big databases. But he says this is a great idea, and the fact that you're going to have then the people that have always tried to publish something, but because they are going against the narrative, they cannot get published. Now they have an avenue where they can publish. If their data is good, I don't care if they tell me that they're using a magic mushroom to, cure something. If the data is there and I can prove that that's there, we're going to publish it. We're going to publish it. We are an avenue for people to get their true research well done, in the most or strictest mode of scientific conduct, ethically sound, to be able to publish. That's what makes us different than the rest of the world.
Now, all of this is not a quick and easy process and will likely be a few more years in the making.
I have indexed several journals throughout my life. I'm still the editor-in-chief of 3 additional journals, and it takes time. The simplest indexing, we are already indexed with the National Library of the National Library of Congress. So that gives us what is known as the ISSN number. But then after this, we're going to have to go through Scopus, we're going to have to go through Embase, and eventually we're going to have to go through something that's called PubMed, which is the National Library of Medicine. That takes about 2 to 3 years to get the indexing, and that's extremely political. That's going to be, if we're going to have a hurdle to fight, that's going to be the one that's going to be. Because it's very political. They may not like the topics. They may not like, and they will keep on rejecting it. But if they reject it, we'll try again, and we'll try again. And I'm going to get this journal indexed no matter what. We will be launching, like I said, in a couple of months. Submissions, we do have a submission email address, which is submissions at the FLCCC.org. And people can submit their papers there. And if they have questions, like what kind of format, for the time being, that's what we're going to do. We are creating an electronic submission system. So we're doing everything by the book.
Overall, the goal is to give a peer reviewing opportunity without conflicts of interest, without funding conflicts by the pharmaceutical industry, and this would truly set the FLCC's medical journal apart from what exists today. For Rebel News, I'm Tamara Ugolini. This story shows the catastrophic effect that censorship has on a functioning democracy and finding tangible, appropriate solutions to issues plaguing our society. If you'd like to support furthering conversation instead of censoring and canceling it, please head over to stopthecensorship.ca. There you can find out what we're doing to push back against the Justin Trudeau Liberals' sweeping online censorship plans and get involved if you'd like. That's stopthecensorship.ca.